Are you suffering from knee pain? Do you have knee pain the day after your gym workout, or the day after hiking, or after some form of intense activity? Do you have knee pain when you get up in the morning, or when you stand up after sitting down for a long time? Knee pain alongside with back pain is one of the most common causes of musculoskeletal problem. If you suffer from knee pain and want to get better, then this video might help you understand your problem and potential options to get better. The purpose of this video is only for education. It does not constitute medical advice. If you suffer from any of the conditions mentioned in this video, please consult your doctor and/or healthcare professional. In order to understand knee pain, we need to first understand the science behind it. We will first look at the anatomy of the knee joint and also look at potential causes of knee pain. Then we will consider and evaluate the effectiveness of different options commonly available. This video is by no means complete or comprehensive, but only serves as an overview of common issues relating to knee pain, and in particular relating to degenerative knee pain rather than acute or traumatic knee pain. The knee joint is made up of three major bones. The femur is the major bone at the top. This is a thigh bone that is connected to our hip joint. Then below the femur is the tibia, which is the shin bone that forms the lower part of our legs. Then there is the patella, which is the kneecap in the middle. And then there is the fourth bone, which isn't necessarily included within the knee joint, is the fibula, although there is a ligament attached to it. The fibula is on the outside of the shin. The bone surface of the knee joint is covered with articular cartilage. It provides a low friction surface to allow the bone surface to glide smoothly against each other and to enable the knee joint to withstand weight-bearing actions and movements. The meniscus sits in between the femur and the tibia. It acts as a shock absorber for the cartilage during weight-bearing actions or movements. The knee joint is a condylar joint. It is not a classic hinge joint. Yes, it is able to hinge. We can bend the knees and also extend the knees. We can also rotate the knees to the left and to the right, although this medial lateral movement is only very minimal. There are four major ligaments within the knee joint: the ACL, PCL, MCL, and LCL. i.e. the anterior cruciate ligament, posterior cruciate ligament, medial collateral ligament, and lateral collateral ligament. These ligaments provide the basic stability of the joint, which would be described as passive stability. Together with the neighboring muscles, they provide active stability of the knee joint. Essentially, the ligaments are keeping the knee joint in place, enabling flexion and extension of the knee while limiting rotation at the knee joint. Knee problems may be classified as acute or degenerative. Acute problems are usually sudden and traumatic, usually related to a particular incident or activity. This happens mostly in sporting activities and accidental incidents, such as a sudden fall. In contrast, degenerative problem manifests only after a long period of time. This is usually described as wear and tear. However, acute problems in the past may contribute to degenerative conditions later on in life. Conversely, the cumulative effects of degenerative conditions may also manifest in a particular incident, although that incident could just be the last straw that broke the camel's back. In this video, we will be focusing on degenerative knee conditions, as this is one of the most prevalent problems with most of our audience. The most common knee problems relating to degenerative conditions are 1. Degenerative meniscal tear, and 2. Knee osteoarthritis. As we mentioned earlier, meniscus is the shock absorber in between the femur and the tibia. Degenerative meniscal tear would typically have minimal or no trauma. There wasn't any particular activity or incident that is directly responsible for the pain. You could feel the pain even when sitting down or getting out of a car. Typically, people who suffer from this condition are not young people. Instead, people over 45 years of age are more likely. They may not have a lot of swelling or inflammation as compared to people with acute meniscal tear. Some people with degenerative meniscal tear may not even have any symptoms. So even if you have degenerative meniscal tear, you may not feel any pain at all. So how do we treat knee pain due to degenerative meniscal tear? Is it necessary to do a surgery, or are there any other more conservative options? There was an article published in 2013 entitled Surgery versus Physical Therapy for a Meniscal Tear and Osteoarthritis. The key findings of the article may be summarized as follows. Either surgery or physical therapy will make you feel better. There isn't much difference between surgery and physical therapy in terms of pain relief after 1 year. Physical therapy for degenerative meniscal tear is beneficial for pain relief. Surgery for degenerative meniscal tear is not necessary. This means that surgery is an elective procedure. There is evidence that those who initially started with physical therapy and later opt for surgery achieve a similar result after 1 year. So it is recommended to start with physical therapy, and if that fails, then surgery is still an option. Another question that many people are concerned about degenerative meniscal tear is that, will this condition lead to arthritis? Well, generally speaking, having degenerative meniscal tear does not seem more or less likely to lead to arthritis. It doesn't seem to change the natural progression of your knee. However, there are risk factors that may make it more likely to lead to arthritis. These risk factors generally relate to the position or severity of the meniscal degeneration, such as extrusion, complex tears, radial involvement, etc., etc. Let us now talk about the second degenerative knee condition, i.e. knee osteoarthritis. Knee osteoarthritis is a mechanical degeneration of the knee joint's articular cartilage. In other words, it is a condition caused by wear and tear of the knee joint, resulting in progressive loss of cartilage. Our cartilage is very smooth, and it has no nerve endings. So, normally, we don't feel the joints moving on a daily basis. The bad news is that because it has no nerve endings, there is no early warning system. So our body won't know that we have arthritis until we have already lost a fair amount of cartilage. Our body generally can't make or regenerate new cartilage. So when we have osteoarthritis, this condition is basically irreversible. What are the symptoms of osteoarthritis? These include pain, swelling, effusion or accumulation of excess fluid, loss of range of motion, deformity, inability to do the things that we want to do, like exercise or daily activities. The knee may be clicking, grinding, or popping, etc. It is common to take some form of imaging like X-ray or MRI to examine the severity of knee osteoarthritis. However, whatever is shown on the imaging, such as mild, moderate, or severe arthritis, the degree of degeneration does not correlate with the symptoms. In other words, how we feel and the amount of pain we suffer do not correlate to the result of the imaging. For example, some people may have severe arthritis, but they may not feel much pain at all. So, when we have knee osteoarthritis, what can we do? There are mainly three categories of treatment options available. The first is non-operation treatment or conservative treatment. Second is injection. And the last one is surgery. There are a number of possibilities within non-operation treatments, such as oral supplements or medication, weight control, physical therapy, and the use of orthotics or instruments. These days, many people like to take supplements to solve their health issues. In particular, many people like to take glucosamine to resolve their knee problems. But is this effective? Contrary to what most people think, the American Academy of Orthopedic Surgeons do not recommend using glucosamine and chondroitin for patients who experience pain due to knee osteoarthritis. They concluded that these supplements are no more effective than placebo. In fact, your money will be better spent elsewhere. The next option is taking non-steroidal anti-inflammatory drugs such as ibuprofen. While many people like to take supplements, but they might be averse to taking medication for the knees. Nevertheless, the American Academy of Orthopedic Surgeons do recommend that low to medium doses of non-steroidal anti-inflammatory drugs which help decrease inflammation is beneficial for patients with knee pain due to osteoarthritis. This option is very beneficial for people with inflammation symptoms in their knee joints. We all know that being overweight can affect our health conditions. But what does weight loss have to do with arthritis? Studies have shown that weight loss does lead to less knee pain. Every kilogram of weight loss will result in 4 kilograms of less force off the knees. So, if you lose 5 kilograms, that means that there will be 20 kilograms less force off your knees. This will then translate into less knee pain. Conversely, every kilogram of increment in body weight will also increase 4 kilograms more force on the knees. So, if you are suffering from knee pain due to osteoarthritis, it is important that you also look at your dietary and exercise regime. A number of studies have shown that physical therapy interventions are beneficial for osteoarthritis of the knees. However, it isn't clear whether any particular type of exercise would be considered the best, although exercises strengthening the hips and core seem to have somewhat better results. Last but not least, we may also resort to instruments or orthotics such as knee sleeves, knee braces, magnet, taping, ultrasounds, etc. as a way to manage our knee pain. There isn't a lot of studies on this, but these instruments seem to have marginal benefits for the knees, although they are not going to change the biologic environment of the knee joint. In other words, they may provide temporary relief for the knees, but they are unlikely to be able to solve your problems. Now let's talk about injections. There are a variety of injections available for treating knee osteoarthritis. We will discuss 4 different types of injections here. namely corticosteroid, hyaluronic acid, PRP or platelet-rich plasma, and stem cells injections. The most common injection for knee osteoarthritis is corticosteroid injection. Most studies have shown that steroid injection has limited benefit for a short period of time, usually 3 to 6 months. These injections can be somewhat risky because of the numbing agent lidocaine used in the injection, which can transiently increase blood sugar. However, there may be other options now available for steroid injections. Hyaluronic acid injections lubricate and cushions the joint. Very little is known about the exact mechanism of how this works, but it seems to decrease inflammation and decrease pain. However, the American Academy of Orthopedic Surgeons do not recommend use of hyaluronic acid for osteoarthritis patients with knee pain. Their recommendation is based on limited benefits as compared to the relatively high cost of treatment. The evidence for platelet-rich plasma or PRP as compared to other injections is still rather limited in the literature. The PRP injections seem to do a little bit better than other injections, and there is minimal side effects. However, there is still no long-term data on the use of PRP injections. Stem cells sound really promising. However, stem cells do not differentiate, and the final result is dependent on the cells in the local environment. There is currently very little evidence whether stem cells actually work. Perhaps this is still too early to tell. Last but not least, the final common pathway for everyone with knee osteoarthritis is knee replacement surgery. This is usually applicable for people with moderate to severe arthritis. This is essentially a replacement of cartilage surface with metal and plastic surface. Knee replacement is considered the last resort. Other than recovery from the surgery, it provides immediate pain relief. Generally, it can provide good range of motion and moderate motor function of the knee. Therefore, this may be suitable for patients with low to moderate demands regarding the use of their knees. A common question about knee replacement is the longevity or lifespan of the knee. There is evidence of good results up to 10 to 15 years. You should consult your doctor and talk about potential risks with the surgery as well as maintenance and side effects after the surgery. Well, that's all for today. We hope that this video is informative about degenerative knee conditions and potential treatment options. If you find this helpful, please share this with your friends and family members who might also benefit from this educational tutorial. If you like this video, please like and subscribe to our channel so that you will not miss out on our future videos.